When diet is wrong, medicine is of no use. When diet is correct, medicine is of no need. A very good evening to everyone. I am B. Sindhu. Take the privilege in comparing Health Fest 2K22 organized by DORAI Foundation in collaboration with the Department of Nutrition, Food Service Management and Dietetics from Srimati Devkunwar Nalalar Bhatt Vaishnav College for Women, Krompet and Indian Dietetic Association, Chennai. A healthy lifestyle keeps you fit, energetic, and at reduced risk for disease. Having a suppressed immune system or chronic health condition can make you more prone to recurring infections and urinary tract infection, a common healthcare problem worldwide. It is an infection caused by bacteria which gets into the urine and travel to the urinary system, your kidney, uterus, bladder, and urethra. Most infections involve the lower urinary tract, the bladder, and urethra. About 60% of women and 12% of men will have at least one UTI during their lifetime, and women are at greater risk of developing a UTI than men. Infection limited to your bladder can be painful and annoying. However, serious consequences can occur if a UTI spreads to your kidneys. To get more knowledge on urinary tract infection, let's connect with Ms. S. Sujata, registered dietitian, our elegant speaker for this event. Sujata ma'am is a registered dietitian, Indian Dietetic Association based in Chennai, India. She chose a major in nutrition to explore the subject, and this directed her into a career that is now super passionate about. Ma'am has been practiced since 2017 after undergoing intensive internship in reputed hospitals in Sri Ramchandra Institute of Higher Education Research Chennai and PSG Institute of Medical Science Research Coimbatore. She graduated with a master's degree in clinical nutrition from Sri Ramchandra Medical College and received the registered dietitian credential after clearing the qualifying exam from Indian Dietetic Association. Ma'am further pursued a PG diploma in fitness and nutrition from Tamil Nadu Physical Education and Sports Institute. The majority of clients have been from sports professionals, young athletes, and people who require guidance with regards to physiological and weight management. Ma'am has particular interest in genetics, personalized nutrition, and critical care and holds certifications in the same. She also has a passion for teaching and being made eligible for assistant professorship through NET. Ma'am has handled a few papers on nutrition for undergraduate students of reputed institutions, Etrach Women's College and MOP Vaishnav College as a guest lecturer. She is currently practicing as an independent nutritionist dietitian. Ma'am finds it extremely satisfying to have a career where she can guide people and be a part of their journey towards wellness. It's my honor and privilege to welcome Ms. Sujata ma'am, our esteemed speaker for today's scientific talk. I owe to you, ma'am.
Yeah. I hope I'm visible and audible to all of you.
Yes, ma'am.
Perfect, perfect. Thank you so much, Sindhu, for that energetic start for today's session. And if we can share the screen, we can begin with today's topic. Perfect. So, yes, without further delay, I'll jump right into the topic for today, which is urinary tract infections. Firstly, I was really surprised that we actually chose to, have a session on this and have a discussion on this because this is a very common problem among a lot of people. Almost like every other person you see would have had history of any form of urinary tract infection, but it is also a topic that's not very commonly or very often discussed, right? So it is really great that we chose this topic as a part of this session. So Sindhu already gave a brief introduction on what UTIs are and its prevalence. So we'll just quickly brush through the basics a bit before we go on to discussing what exactly we as nutritionists can do to help someone who comes to us with a similar concern, right? So if we can move to the next slide, please. Yeah. So basically, UTIs are like the name itself, conveys. It is an infection in your urinary tract. Now, your urinary tract involves your kidneys. It involves your ureters. It also includes your urinary bladder and also your urethra. And for men, there would be an additional organ, which is the prostate. So all this together is what comprises your urinary tract. And the most common UTIs are caused because of bacteria. And to be more specific, it is E. coli bacteria that causes most UTIs. Now, you would have known E. coli is not something new to us. It is a very common a bacteria that inhabits our gut. So, the common cause of UTIs is again a transfer of this bacteria from the gut into your urinary tract through your urinary opening, which is your urethra, right? And secondly, it is highly prevalent condition. And apart from bacteria, even fungal infections or even viral infections can cause UTIs, but it is not as common as the bacterial infection. But what we have to note here is that in case there is a viral infection, it can be much more deadly because the treatment can be difficult. And the next thing is it is more common among women and mostly among the older population. And also, it is more commonly observed in your lower urinary tract than in your upper urinary tract, although the other is also possible, right? Can we move to the next slide? Perfect. So, a little bit on why exactly it is more common in women than among men. The main reason is that women have a smaller urethral passage. So, it becomes very easy for these bacteria to get transferred through the urethra and enter into your urinary tract and exhibit symptoms of infection more than it is for men, because for men, the passage is much longer. So, the difference here is actually big. In women, every other woman almost has a history of UTI or has a susceptibility to develop UTI, but among men, it is just 1 in 20, right? So that much of a difference is there in terms of prevalence between the different genders. But it is very much possible to develop UTIs like across gender and also across different age groups. We'll move to the next slide. Perfect. So this is a very simple representation, a diagrammatic representation of your urinary tract. So, like we already discussed, these are the different organs that comprise your urinary tract. Now, when the urinary tract infection is confined to your urinary bladder or your urethra, your urinary bladder is what stores your urine. Your urethra is the opening through which you expel urine. So, when your infection is confined to these regions, it is the lower urinary tract infection. And when your infection is confined to your ureter or to your kidneys, it is upper urinary tract infection. Lower urinary tract infection, like we mentioned earlier, is more prevalent than upper urinary tract infection. But upper urinary tract infection tend to be more risky. It can even lead to death if not, diagnosed appropriately and treated appropriately. So, if we can move to the next slide. So, depending on where exactly the infection is and depending on where the inflammation is, urinary tract infections can be of different types. The most common one would be urethritis and also cystitis and prostatitis. Urethritis is basically inflammation in your urethra caused because of infection. Cystitis and prostatitis is inflammation of your urinary bladder and for men, the prostate gland. in response to infection. And also, pyelonephritis is a much more serious condition where the kidney is inflamed. It is nephritis, which is inflammation of the kidney because of a bacterial infection. So, these are the three common types of UTI infections that you'll come across. We'll move to the next slide. Perfect. So, the good news here is that urinary tract infections are easily treatable, most of them, right? So, most of them fall under the uncomplicated category. So, it only involves early detection and also appropriate treatment. So once you develop, because most urinary tract infections come with good amount of symptoms, so mostly the patient himself or herself would be able to identify it as a possibility for urinary tract infection, and they could reach to a medical professional who would further diagnose the condition and recommend appropriate treatment. So most of the cases are uncomplicated and it is very easy to treat. It is also easy to prevent because most of the causes of uncomplicated UTIs are also preventable. They are all behavior related. But there are few cases of complicated UTIs which could involve the kidney. Now, what makes UTIs complicated is that when the kidney is involved, when you have infection that spread to your kidney, you have a lot of blood vessels supplying your kidney. So, this infection can easily enter from the kidney into your blood, which can again spread throughout your body through your blood. So, this is called sepsis, more specifically urosepsis. And this can be a life threatening condition because it can lead to septic shock. It can affect other organs. It can spread the infection to other organs, leading to organ failure or even death of a person, right? So, that is why infecting on the upper respiratory tract can be more risky than those that infect the lower urinary tract. So if we can also majorly the complicated forms of urinary tract infection would be observed in people who are immunocompromised. So basically, if anybody is undergoing any medical treatment, say for example chemotherapy, that can directly affect a person's immune system, it can also make them more prone to developing UTIs. Pregnancy is again a phase where UTIs are very, very common because pregnant women excrete urine which has a lot of sugar, which has a lot of protein, which would also have a lot of hormones, which are all like really good medium for bacteria to multiply and cause an infection. And also certain anatomical functional abnormalities of the urinary tract. For example, if there is a person who is critically ill and is admitted in the hospital, or a person who is bedridden and requires inserting a catheter to expel urine. So, all this can actually make someone more prone to developing urinary tract infections. There can also be congenital abnormalities in terms of how the urinary tract functions, or how the urinary tract anatomically is, and that can also make someone susceptible to developing urinary tract infections. So we can go to the next slide. Perfect. So ultimately, treating urinary tract infection comes down to early diagnosis. If we are able to detect urinary tract infection and give appropriate treatment, it is something that's not majorly a health concern. So diagnosis is majorly based on symptoms as well as medical tests. So symptoms are very much common among urinary tract infections, and most of even different infections contain overlapping symptoms. So we will be discussing them shortly. And also, after you reach your health professionals with specific symptoms, they will be doing certain diagnostic tests to confirm and also to identify what exactly is causing an infection, because infection is a very general term. Unless until you know what exactly, or what species of bacteria caused the infection, or what kind of microorganism caused the infection, accordingly treatment has to be planned. So depending on what a patient presents with, the medical professional would also opt to go for blood checkups. Now, one thing that's very interesting to observe here is that it is very much possible for some people to not have any symptoms at all, but have presentations of urinary tract infections in their blood test. So I've seen this very commonly because there would be clients who do not have history of urinary tract infection and who never been been on treatment for urinary tract infection. But when I do a general screening for general screening of their blood sample for the sake of our nutritional assessment, I would notice signs of urinary tract infections there. And then when I ask them about their symptoms, they kind of maybe face mild symptoms of it. So again, it is very much possible that a person who has urinary tract infection wouldn't exhibit much symptoms unless until the condition has progressed to a certain extent. So we'll move to the next slide. Okay, so these are the very common symptoms of urinary tract infection. One is burning sensation when urinating, and also itching sensation around the place you urinate. Increased urine frequency, so feeling the urge to urinate very frequently, increased urgency of urination, and also feeling of the urine still being there in your bladder, and the feeling to urinate even after you've just emptied your bladder. So all these are very very common symptoms of urinary tract infections. Even you and me would have faced one of these symptoms very commonly. And apart from this, in certain other progressed cases, you would also find blood in the urine. You could also feel foul smelling urine or even discoloration in the urine because of reactions of these metabolites created by the infection causing bacteria. Now, if it is an infection that has affected the kidney, and if it is a serious infection, it could also lead to, or which has spread in the blood, which has caused sepsis. It could also exhibit as fevers or even as chills and even as lower back pain. More specifically, for women, it would be somewhere around the pelvic region. So it would be mostly pelvic pain. And for men, it would be more around the prostate region. So these are the very common characteristic symptoms of urinary tract infections. So these would be the presenting symptoms. So even if your client has one of these symptoms or a combination of these symptoms, you can definitely suspect that they might have a urinary tract infection and advise them to visit a physician for further diagnosis. Next slide, please. Yes. And when it comes to tests, some of the most common presentations that you would observe is presence of your white blood cells or even your RBCs in the blood, which would again indicate that there could be some kind of an infection where your white blood cells have been used and it's actually getting expelled in the blood. Again, cloudy urine because of these dead white blood cells or dead bacterial particles, because urine is otherwise clear. In like to see, it would be in a clear liquid, but a cloudy urine can actually indicate that there might be a possibility of urinary tract infections. And apart from that, doctors would also test your urine for specific bacterial strains, or even send your urine sample for culture so that they can identify what exactly caused the infection and they can treat it. So, as far as nutrition is concerned, there is nothing that can specifically, prevent a particular urinary tract infection, or that can, act against a particular urinary tract infection, or that can trigger a urinary tract infection, because infection is basically caused when when the urinary tract comes in contact with a disease-causing microorganism. So, there's no way to actually directly link nutrition here, but definitely having an overall overall good state of health, and which is supported by a good nutritious diet, can actually help prevent or help your body cope with these infections in a much better way, right? So we'll move to the next slide. Okay. So basically, the causes, like we already discussed, One of the major causes is transfer of bacteria from your anus. Now, this can happen if your hygiene practices are not in place. And also, when there is a very frequent sexual intercourse, that can be one of the causes that can make someone susceptible to urinary tract infections. Also, it can be very rarely spread through the blood, but otherwise it's more external. And practicing hygienic practices can actually help prevent this risk factor because it is a behavioral cause and it can be modified easily. The next thing is around your fluid intake, right? Not drinking enough fluids can actually make us more susceptible to urinary tract infection, because when we don't drink enough fluid, we are not going to urinate frequently, and when we don't urinate frequently, we are not giving our body to flush out all these multiplying bacteria from within, right? So when you hold a lot of urine, again, urine contains certain solutes which can be an amazing medium for these bacteria to multiply and cause infection. So when you urinate frequently, it will actually prevent your susceptibility to developing urinary tract infections. So make sure that you don't hold your urine for long hours. Mostly working professionals, teachers, people who are involved in sedentary kind of a work environment tend to hold their urine for very long hours, and this can actually be the reason why they develop frequent urinary tract infection. Again, urinary tract infections can be recurrent as well, so it's not just something that's acute and once treated it's gone. It can recur and happen multiple number of times. So it's important that we pay attention to the causes and its risk factors throughout your life, and not just during the phase of the infection. So these two are the major reasons why someone would develop a urinary tract infection. But apart from this, we discussed how immunocompromised state can obviously make someone much more prone to developing a urinary tract infection, because again, your immune system is not in place, so it's not well equipped enough to fight or cope with the infection. The second thing is again kidney stones or other obstructions, like malignant tumors or even benign tumors in your urinary tract, which could actually obstruct the passage through which urine is expelled from your body. So urine can collect within the urinary tract and it can lead to infections. Again, diabetes and pregnancy we already discussed. Diabetes, again, because the sugar is concentrated in the urine, your bacteria can multiply, and the effect of the infection could be much more severe in someone who doesn't have blood sugar control. And again, age and gender. Older people tend to develop UTIs more frequently. And also, it might be relatable to a natural decline in immune responses, or generally in older women in particular, there is a drop in estrogen levels, right? Especially in like perimenopausal or menopausal or postmenopausal women, there are a lot of hormonal changes, and these hormonal changes can be linked to increased urinary tract infection risk, because estrogen again has a very important role to play when it comes to your immune system, right? And also gender, we already discussed how women are much more prone to developing UTIs than men. Next slide. Okay, so this is where I would want you to pay a little bit of attention, because this is the main part of the topic. So the first thing that you have to do when managing someone with UTI is to assess their fluid intake habits and make modifications that can help prevent risk factors to UTIs. So one thing that you would find common among people who present with UTIs is an insufficient intake of fluids. And also improving on fluid intake could help improve the frequency of urination, which would again help flush out the bacteria that's causing the infection alongside medical treatment. So it is important to advise on improved fluid intake. Now, how much fluid is adequate for a person? Again, fluid intake tends to, fluid requirements tends to vary from individual to individual. So what is adequate for me wouldn't be adequate for someone else, because our sweat rates differ, the amount of water we lose through different means differ from each other, right? So what we can do is advise your client to observe their urine color. If their urine color is concentrated or dark on most times, then it means that they have to step up on their water intake. So, this is a very useful tool and a very easy tool to actually assess if someone is drinking enough water. The second thing is, sometimes a foul smelling urine, not exactly foul, but it would be a strong smelling urine. So that strong odor comes when the urine is highly concentrated. So your urine comes with urea and creatinine and all these waste products that your kidney excretes, right? So now when your body doesn't have enough water and the urine that's coming out is concentrated, these particular solvents tend to have a lot of they tend to give out a odor. So that can again be one of the symptoms that we can assess to see if someone is drinking enough water, and advise them to step up on their water intake. And again, burning sensation can be relatable to increased solvents in the urine, and this again can you would have to address improved intake of water. Now, how to have this water? So basically, taking like 1 gallon of water at a time and then leaving long hours without drinking water is again of no use, because no matter how much you drink at a time, your body will only utilize what it needs at that particular point of time, and then it excretes the rest via your urine, right? So it wouldn't be much helpful to maintain your overall hydration. So what you can do is advise them to have frequent gulps of water. So a gulp of water can somewhere be between even 150 or 200 ml or 250 ml, depending on the individual. But just ask them or advise them to have frequently. So it can be once in 30 minutes or once in 40 minutes, and that could add up to their overall fluid intake for the day. So this is one thing that we can do to ensure that someone stays in a state of normal hydration throughout the day, and not have spells of dehydration and overhydration. So this is extremely important. And again, for some people, stepping up on their water intake can tend to be difficult. One thing that can help a lot with this is to flavor your drinking water. So what you can do is you can advise them to maybe add in ginger or jeera or even cinnamon, or if they like the taste of lemon, they can add lemon juice, or they can use diluted fruit juices to flavor water. So when your water is flavored, you tend to drink more, because it's more interesting. Or one more thing that you can do is use a graded bottle, like a bottle which has graded ml on it, and ask them to target drinking so and so ml or so and so liters in a day, so that they have an idea, like even in case they forget to drink water, they know how much they have to finish for the day. So they would be conscious about drinking enough water throughout the day. So these are few things that you can do as far as fluid intake is concerned. The second thing is, an overall good nutrition is again essential. Why? Because it is extremely important for your immune system to function. People who are on highly restrictive diets, who are trying to lose fat, and who are going through diets that are really low in calories, 800 calories, 1000 calories, their immune system gets tampered, and this can again make them much more prone to developing complications of any infection, including urinary tract infection. So it's very important that you advise them to eat adequate calories. So even if someone's trying to lose fat, even if they are on a calorie deficit, the calorie deficit shouldn't be too much. That it affects the basic functioning of your body, right? So it has to be calculated, and it has to be, advised appropriately. Low calorie diets are definitely going to affect your immune system. Apart from that, adequate protein is again essential for your immune system to function. good amounts of omega 3 fats and even mufa fats are essential because they have an effect in terms of your inflammatory markers and how your body handles inflammation. And again, certain micronutrients that are highly essential for your immune system to function would be zinc, selenium, all your fat soluble vitamins, including A, D, E, K. So, all these are essential when it comes to functioning of your immune system. So, advise on an overall balanced intake of all these essential nutrients which can support a good immune system. Another thing that's very, very important is urinary incontinence. Now, this is again very common among women, although even men, face it. And the most common reason why, some people tend to develop urinary incontinence is because of weak pelvic muscles. So, if their pelvic floor muscles are weak, and they don't have enough muscle turgor to hold their urethral opening, then it can lead to incontinence. And this again, in the long run, can make you susceptible to developing urinary tract infection. So again, focusing on maybe giving references in terms of improving exercises in terms of improving pelvic floor strength alongside a good diet, because again, for your muscles to tone and for your muscles to strengthen, you need good amounts of proteins and even carbs and fats and other vitamins and minerals to establish good muscle contractions. So again, that would be a very important aspect to address in terms of urinary tract infections. The other thing is again avoiding food triggers. So there are no major restrictions as such when someone has urinary tract infections, but there are certain foods that can irritate your bladder. So these can be acidic foods, which can basically be citrus or tomatoes, pineapple and fruits like that. They are healthy, but when over consumed, they tend to irritate the bladder. So apart from that, caffeinated beverages are found to irritate the bladder. So having too much coffee or too much tea needs to be avoided. And again, any kind of processed food, refined food can irritate your bladder. And in particular, carbonated beverages should be avoided because that can again, be irritable to someone who has a history of or who is going through a urinary tract infection. So these are few things that you will have to advise them on. And apart from all this, we would also need to pay attention to treating the underlying cause. So if it is diabetes, for example, make sure that you address that condition. Make sure that the client has you give strategies for the client to establish normal glycemic control, which can again in turn reduce their susceptibility or reduce their complications due to urinary tract infection. So addressing the root cause is again extremely important, because symptomatically we can always change few things, but if the root cause is not addressed, then it's going to come back. So always figure out what the root cause could be. If it is behavioral, advise behavioral changes. And if it is something physiological, also make sure that you pay attention to those specific physiological parameters and help the client improve them. Can we move to the next slide? Yeah. So, like I mentioned earlier, there is no specific food that can actually, work in terms of treating urinary tract infection. Actually, traditionally, and even in Ayurvedic practices or naturopathy practices, there are few foods that are used in particular for urinary tract infections. But scientifically, they do not have a very strong backup. So we cannot really for sure say that these foods are going to help treat or help prevent these infections, but there is definitely no harm in trying them. So three of the common foods that are recommended like generally traditionally are: one is barley water. This we would have heard of it very commonly even among our households. It is something that's commonly used to prevent or even rectify urinary tract infections, because it is a natural diuretic and it can help you urinate more. So basically, with for barley water, what they do is take handful or fistful of barley, boil it with like 500 ml of water, reduce it until it becomes half, and then filter and have it. One thing that you have to be careful about using barley water is that it tends to contain gluten. So in case it's a person with gluten intolerance or gluten sensitivity, you might have to avoid it. Another thing is using tender coconut water. Again, it is rich in electrolytes and fluids, and it also is found to have natural diuretic properties and can help improve urine production. Again, cranberry juice is one component that's been commonly studied in relation to urinary tract infection. So unsweetened cranberry juice can be used. There are other berries like blueberries also been researched in link with urinary tract infection. So, apart from this, one thing that's found to be very, very effective in terms of modifying how your body responds to these infections is improving on your probiotics intake, right? So, probiotics are basically food, the bacteria that can actually interact with your gut bacteria and can exhibit certain beneficial effects. So, your food can also be a source of probiotics. There are also supplements available for probiotics. But how exactly they work is different components of our body tend to have different, bacterial flora, and these bacterial flora often interact, and they tend to modify each other. So, having a good gut flora can actually be beneficial in terms of, even preventing urinary tract infections. So make sure that you include a lot of fermented foods in your diet. So for by fermented foods, not all fermented food tends to have good probiotic properties, because if you see idli, dosa batter are also fermented. They also come under fermented food. But then we cook idli, we steam idli, and we cook dosa, and cooking can actually kill the beneficial bacteria present in them. So, even when you're recommending fermented foods, make sure that they contain live cultures of these beneficial organisms, which can actually help with a particular clinical outcome. So commonly the most easiest option to involve probiotics in your eating pattern is to include probiotic curd or probiotic yogurt, which is very, like, easily available. Other options can be kombucha and products like kefir, but these tend to be a bit unaccessible, and even if it were accessible, it tends to cost a lot, so it may not be something that you can recommend for everybody. But curd and yogurt is something that you can easily access. Another thing that you can do is you offer foods that can be fermented at home. It can be overnight oat, or it can even be our traditional paraya sadam, where they ferment rice overnight, and they add in vegetables and onions and consume it the next day. So this can again be a good source of probiotics. Again, there are few studies that link a vegetarian diet to better outcomes in terms of urinary tract infection or lesser prevalence of urinary tract infection. Now, this can again mainly be because of the increased fiber intake among people who follow a vegetarian diet. Again, fiber are prebiotics, which can actually help feed the flora in your gut, and that could be the reason why it has a particular effect. So again, combining probiotics and prebiotics together into your diet can actually help improve your immune response to urinary tract infection. So again, all these recommendations could work for uncomplicated urinary tract infection, because anyways the doctor is going to put the patient on antibiotics as well. So again, when there are antibiotics used, you need to be you need to pay attention to certain nutrients, especially again probiotics, because antibiotics can also kill good bacteria in your gut, so you might have to replace them. Another thing is when UTIs are treated, a person can be more susceptible to developing vitamin D deficiency or even B6 deficiency, especially when the UTI is more complicated, like which involves the kidney as well, because the kidney function is extremely important when it comes to activating your vitamin D vitamin D inside the body for its functions, right? So it is important that you pay attention to certain micronutrients as well. Again, when there is excess use of antibiotics, or even when someone is going through a course of antibiotics, there can be disturbances in terms of how much vitamin K or B12 your body secretes. Your gut bacteria also secretes vitamin B12 and K, and that can be affected. So again, addressing vitamin K sources and vitamin B12 sources can actually be extremely useful when it comes to treating UTIs. And in again, complicated cases of UTIs where the kidney is affected and kidney function is affected, then you might have to treat it like how you would treat a kidney dysfunction. It could be an acute kidney dysfunction. It could even lead to a chronic kidney dysfunction. There could be cases where which require dialysis. So depending on what kind of the severity of the infection, and also depending on what kind of treatment has been planned, you might have to modify your nutritional recommendation accordingly, because a person who is on dialysis would need a higher protein, but a person who is in the initial stages of kidney dysfunction and but has compromised kidney function, then you might have to even restrict on protein intake. So depending on what a patient presents with, you might have to plan their requirements. Again, energy per se, if the kidney is extremely compromised, you might have to increase their energy intake, because they would need that energy to actually help the kidney recover from the infection. So all these need to be kept in mind when it comes to treating complicated kidney dysfunction in response to certain infections, right? So if we can move to the next slide. Perfect. So these are the points that I wanted to highlight. So we are open for questions now. I'd be happy to take a few questions before we wind up. And in case you need to contact me for anything, you can make note of my contact details as well. Thank you so much.
Thank you, ma'am, for the wonderful and informative session. Curiosity is the engine of achievement. Ma'am, shall we have question and answer session?
Definitely, yeah.
Dear participants, you can drop your questions in the chat box.
Can I read the questions from the chat box?
Yes, sure, ma'am.
Perfect. So, yeah, so the first question here is how to cure PCOS. It's out of the topic, but still, PCOS is, there's no one particular diet that can cure PCOS, and PCOS cure in itself is not possible. It's going to be there, but it can definitely be managed. So it's mostly lifestyle management, which would include an overall change in terms of your eating pattern. It should include a change in terms of your exercise routine, and also in combination with medical therapy. And there are different types of PCOS, so depending on the PCOS and depending on the cause of PCOS, the recommendations would change. So that's how much I am able to say right now. uh, can UTI lead to kidney stone? UTI cannot lead to kidney stone, but having a kidney stone can actually make someone more susceptible to developing UTIs. Uh, I think the tips for what I don't understand. Does vaginal wash prevent UTI? Actually, vaginal washes are something that you needn't do in terms of, even in terms of UTI or vaginal infections, because your vagina is self cleansing. So you just need to wash it with water, and that's more than enough. some of these vaginal washes tend to actually kill certain healthy bacterial flora in your vagina, which can again make you more susceptible to developing vaginal infections. So vaginal washes are not recommended even by doctors. Oh, thank you. Does keeping napkins for long hours? It can, because again, it is a very good medium for your fungi or your bacteria to multiply. And when it is constantly in contact with your urethra, it can definitely, increase your chances of developing a UTI. So it definitely can. It's important that you replace your napkins at least once in 4 hours or 5 hours. Also, there are other alternate options available, like menstrual cups, which can make your risk much lesser, because when you use menstrual cups, your blood collects inside your body. It doesn't come out until you take it out to empty it. So that can actually prevent infections, vaginal infections, as well as UTIs. If a pregnant woman develops UTI, does it affect the fetus too? If it spreads to the blood, then there is a chance that it can also enter the fetal circulation, but otherwise, no. And this again is very rare. So it usually isn't a concern. And mostly pregnant women develop, UTIs to do with their lower urinary tract and not the kidneys. So unless until the kidney is involved, there is no major risk. Interstitial cystitis and UTI are same. So cystitis is basically inflammation of the bladder. So infection is a very general term. Infection is just that you have a disease causing pathogen that's affecting your organs. Now cystitis is more specific, where it has affected the bladder and it has caused an inflammation of the bladder. So cystitis is more the inflammation part. Anything that ends with itis is inflammation. Does UTI cause back pain? If so, why? Yes, UTI, when there is a severe case of UTI, it can cause lower back pain because your kidneys and your urinary tract, other parts of your urinary tract are present there. So when the inflammation is bad, it can cause pain because there are a lot of nerve endings, and it usually radiates towards your lower back. How to prevent vaginal infections like itching sensation near your vaginal area? Again, the only way to prevent any form of infection is to practice hygiene. So that's the only thing that we can do. And also, like if it's a sexually active person, then they might have to practice washing or peeing after sexual intercourse, and that can help reduce infections. Your presentation, thank you so much. The only cause bacteria, or is there other etiology for UTI? Mostly it is bacteria, and mostly it is E. coli bacteria, but it can also be fungal or viral. Okay, there's an announcement as well. Do we have any more questions? The first step is always to increase your fluid intake. So even if you go to a physician, that's what they're going to advise you. So the first step is always to increase your fluid intake. So if you just have mild symptoms, say like burning urination, or increased frequency of urination and the urge to urinate, you can always increase your fluid intake, and it could actually feel better within a few days. But if it is getting severe and if it is not getting better, then you can always take it to a physician. But it's always better to take it to a medical professional, mainly because if it is something serious, it could be detected earlier and it could be treated appropriately, and that's it. but otherwise no major. Most cases are not severe, so most cases are going to be simple. Is probiotic supplement good? Probiotic supplements are not always necessary. So when if you can just increase on probiotics through food, then that is good to go. But in case there are severe cases, and in case you would want to try a probiotic supplement to see if symptoms improve, you can always try. The most effective supplements would be those that contain lactobacillus species and bifidobacterium species. But in case it's not helping, you can also discontinue, because these probiotic supplements, the bacteria in the probiotic supplement are not going to directly go and have an effect on your urinary tract infection. They are just going to go interact with your gut flora, and the metabolites that they release is what is going to have a beneficial effect. So if your body requires it and if it makes you feel better, we can always suggest a probiotic supplement. But otherwise, in the first line of treatment, it wouldn't usually be required. Thank you so much. Thank you, guys. In medical nutrition therapy view of UTI, is there any macro micronutrient which we should restrict? Nothing at all. Nothing at all. You can, I mean, the macros and the micros can be planned like how you would plan for anybody. But if it is a severe case, if there is the kidney involved, if there is kidney dysfunction involved, and if it is a case of kidney failure, then you might have to restrict on proteins depending on the case. So otherwise, there is no major restrictions. All those are very rare. You wouldn't find people commonly with severe kidney compromise in response to infection. Not in excess, but vitamin D deficiency is very, very common among most of us. Even if you and me test our vitamin D, I'm sure we would fall into the deficient range. And vitamin D is extremely important for your immunity. So it is important to frequently test for vitamin D, and also to suggest supplements to treat vitamin D deficiency, because again, vitamin D is the only nutrient that you cannot meet through food, because you don't have enough food sources of vitamin D which could be good enough to treat a deficiency as such. So you will have to check for the values, and suggest appropriate dosages of dosage and course of vitamin D supplementation. So treating vitamin D deficiency would be extremely important. There are a few studies which say vitamin K supplementation can help in UTIs, but again, it wouldn't be required if a person has adequate vitamin K status again. So that's one thing. And like I mentioned earlier, since vitamin K and B12 are majorly also produced by your gut flora, if there is gut compromise, you can benefit from improving on B12 and K intake. Yes, for some people it does, because citrus fruits tend to be a bit acidic and irritable for the bladder. It is very common that some people are asked to restrict on citrus fruits because it can irritate, someone who has an infection. But when after their symptoms have slowed down and when they are in their recovery phase, you can definitely use citrus fruits, because they are a good source of vitamin C, which is again extremely important for immunity. So until you are not able to, give someone citrus fruits, you can use other sources of vitamin C. Capsicum is a good source. Cabbage is a good source. Guavas are a good source of vitamin C. berries are good sources. So anything that doesn't irritate an individual, you can always try alternate sources.
Ma'am, I too have an one question, ma'am.
Yes, Sindhu. Yeah.
How can pregnant woman can prevent from UTI, ma'am?
So again, it comes to improving fluid intake. One of the major causes why pregnant women land into UTIs is because their frequency of urination is also high because of the pressure the fetus puts on their bladder. Because of which most of them try not. I mean, they don't drink enough water because it makes them urinate more frequently. So that's how they land up into developing urinary tract infections. So the first thing, like for anybody, it is to improve on the water intake. So even if someone has to, go through the difficulty of urinating frequently, it's very, very important to hydrate appropriately and keep flushing urine out of your bladder.
Thank you so much, ma'am. Participants, if you have any questions, you can drop your questions on chat box.
Yes, it can. It's the simplest and the most effective thing that can, reduce incidents and also prevent UTIs and also help treat UTIs. If a pregnant woman is deficient in a certain nutrient, will it lead to UTI? Uh, if there are nutritional deficiencies, it is possible that someone might be susceptible to infections. But if they can prevent, occurrence of infection, they can still, by practicing hygiene practices, then it can still be prevented. But deficiency definitely makes someone, much more prone to developing complications of infection because it can, reduce your immune response. So that's the only thing. Infection cannot be like prevented as such. You would still acquire infection if you are exposed to the microbe, irrespective of whether you have a deficiency or not. But having a deficiency can, hinder how you cope with that infection. Maybe if I have sufficient levels of these particular micronutrients, I would be able to cope with the infection much better and prevent it from, developing into the other symptoms than when I have a deficiency. Thank you so much, ma'am.
Thank you so much, ma'am, for answering all the questions very patiently.
No problem at all. Thank you. It was a pleasure being here today. Thank you so much for inviting me, and all the best for your series. Yeah.
Thank you, ma'am. Thank you, ma'am, for telling us about the various tests taking for diagnose UTI and some strategies on preventing and treating UTI and some healthy food habits to prevent UTI, ma'am.
Thank you so much. Thank you. Thank you for having me.
Gratitude opens the door to the power, the wisdom, the creativity of the universe. On behalf of DORAI Foundation and from Department of Nutrition, Food Service Management and Dietetics, Srimati Devkunwar Nananavat Vaishnav College for Women, Pune, I extend my gratitude to our Honorable Chief Guest, Ms. S. Sujata Ma'am, to take out time from your busy schedule to grace the event. Thank you, ma'am, for sharing your valuable time with us. I thank all the spectators for your presence. And last but not least, I thank the technical team for the support. Dear participants, stay tuned with us to connect for the grand finale on 24 January 2022 from 10:30 a.m. to 12:30 p.m. Don't miss the Explore fun-filled quiz activity on today's topic, nutrition in urinary tract infection, tomorrow at 6:30 p.m. Once again, I thank one and all present here. This is Dora Foundation and Team Nutrition Food Service Management and Dietetics signing off. Stay safe, take care.